from a women's health psychiatrist. Caregiving. While caring for an elderly family member or friend can be intrinsically rewarding, the problem is this. It is often assumed to be women's work, with society viewing women as naturally more nurturing and selfless. So from a young age, girls are often socialized to take on caregiving roles, and this expectation just persists into adulthood. Now, the stress arises when you are being pressured to conform to a role or duty just because you are a woman. And here's another punch to the gut. Because caregiving is viewed as just women's work, female caregivers are less likely to receive help from family and friends or to use external caregiving services. We just assume it's our job, we roll up our sleeves and we get on with it, and no one comes to the rescue. Unfortunately, this heavy responsibility can seriously affect a woman's mental health. Compared to non-caregivers, family caregivers, especially women, experience higher levels of emotional distress, depression, anxiety, and social isolation. Here's 3 strategies to set boundaries around gendered caregiving. The first is just to acknowledge gendered expectations, recognizing the social norms that dictate caregiving roles, often based on gender. Understanding these patterns just help you identify when you're being pressured to conform. 2, communicate your boundaries clearly. If you feel overwhelmed by an assumption that caregiving is your responsibility just because of your gender, have an open conversation with those around you. Try starting with this: I'm not comfortable being the sole caregiver in this situation based on gender expectations. The third is to set expectations in advance if possible. Communicate about who will take on what role and make sure everyone understands the importance of an equitable sharing of responsibilities. Suggest delegating tasks based on ability, availability, or interest rather than defaulting to gendered roles. Please share this with anyone who needs to hear it, and check out the link in my bio for more about this topic.